We're going to very briefly talk about dermatology. And this is just an image to show the layers of the skin as a reminder. Um, if a person is seeking medical assistance or medical intervention for a dermatological condition, and the healthcare provider is taking the history, first thing to know is just basic general demographics, how old the person is, because that's important. Some infectious diseases are more common in children, some other conditions might be more common in older adults. And look at the gender. Some conditions are more common in men, some are more common in women. You want to say race and country of origin. Again, prevalence information is important. And current residence. Is there an infectious outbreak in a certain area? Is it a clue as to a person's exposure to allergens, etc.? Then you also want to consider the lesion. So, what type of lesion is it? And considering that, how long has it lasted? When was the onset? Was it sudden or was it gradual? Is it an acute presentation or an ongoing chronic problem? Have there been previous episodes or reoccurrences of whatever the lesion is? Has it changed in any way? Has it fluctuated or has it been persistently the same? Any variation in the severity? Also consider where the location is. Is it where on the skin or is it along mucous membranes? It's important to consider the site of the lesion because things like eczema tend to be on flexure surfaces, where psoriasis may be on extensor surfaces, more likely. And then you want to look at lesions that have a specific distribution, such as in sweaty regions or in areas that are exposed to the sun. And you also want to consider whether the lesions may have spread. And then also look at things that either increase or decrease the severity of the lesions or the prevalence of it. So heat and cold can aggravate or relieve symptoms, etc. Also, associated symptoms need to be considered. Is it itchy? Certain types of skin conditions are generally itchy. Some may not be itchy. Some are itchy in some areas and not in other areas. Is it tender to the touch, or is there inflammation? Any bleeding or discharge? Often that can be a sign of something that's infected. And are there any other systemic symptoms? Are they fatigue, joint and pain, swelling, unexplained weight loss? So, some of those skin lesions can be markers for other more serious conditions. Also, you want to consider whether there's been any response to treatment. Has the person attempted any treatment, such as antiseptic lotions, maybe calamine lotion, which is an anti-itch, any antihistamines or other over-the-counter steroids or antifungal creams, any herbal remedies, maybe medications that were prescribed for someone else that they've tried, and any other complementary or alternative medicines like Chinese herbs, etc. Partially treated lesions are the most difficult to diagnose because you don't really know what stage it's at. More difficult to be able to garner how long it's been present, how it's responded, etc. In doing a dermatological workup, it's important to get the past medical history for relevant diagnoses like diabetes, maybe lupus, which has a skin condition associated with them. Family history, there's a genetic predisposition to certain diseases, so that's important to know. Eczema and psoriasis are two conditions that have a familial predisposition. What are the person's occupation, hobbies, or pastimes? Because that could lead to some exposure to chemicals or different temperature environments that can cause some dermatological conditions. Have they traveled, gone to exotic locations? Have they been exposed to sunlight over an extended period of time? Are they taking any prescribed medications? So those are all important things to consider in a dermatological workup. Also, smoking and alcohol. Alcohol has been associated with dermatological conditions, as has smoking. Allergies, do they have any allergies that manifest dermatologically? And then, severe chronic or disfiguring skin disease can be exacerbated by anxiety, depression, social isolation, and psychological problems. So important to consider all of those in the dermatological workup. In an exam, a person would look at the general appearance of health overall. Is the person healthy? Look for any clues with regard to a systemic illness, pallor of the skin, their general well-being. Are they put together? Are they disheveled, etc. Also, you want to wipe off, if you're doing a dermatological exam, it's important to wipe off any creams or makeup, anything that might obscure the true nature of what's going on. And then you want to look at the lesion. What is the distribution? Is it symmetrical or asymmetrical? So symmetrical can suggest conditions like psoriasis. Well, something that's more asymmetrical would be a little bit different. Some rashes have characteristic distribution, such as shingles. You want to look at whether the flexor or extensor areas are involved, whether it's in an area of friction or pressure, if it's in a sweaty region of the body, if it's an exposed region of the body. You also want to consider whether sexual contact is a factor in certain areas where there would be some contact that could cause a dermatological conditions. You also want to look at the size of the lesion. Measurement is important because you want to be able to identify whether it has gotten any bigger or smaller, and establish whether it is a single lesion or there are multiple lesions. Then you also want to describe it, and there are different types, different words that are used to describe different lesions. So the first one here in this picture is considered macular, and macular lesions are small, flat spots on the skin, and they're flat. There's no depth or impression from macules. Papule, this is a papule, is an abnormal skin tissue less than 1 centimeter around, has distinct borders, and can be in a variety of shapes. They're often called skin lesions. They're changes in color of the texture of the skin, and sometimes they cluster together to form a rash. Blistering diseases are conditions in which there are fluid-filled skin lesions. So these are vesicles. Vesicles are small blisters that are less than 5 millimeters in diameter. Crusty, basically dry, flaky lesions. And urticarial is a round rash or welts, usually as a result of an allergic reaction to something. So you want to look at the color, shape, regularity. Is there inflammation around it? Is it defined or not well defined? Then touch it. Is it tender? Is it warm? Where is the site on the skin? How thick is it? Is it hard, soft? What is the consistency? Whether pressure leads to blanching, so does it kind of lose its color when it's depressed? Whether it's friable, which basically means it easily fragments when palpated. So think of it as something that little flakes can come off from it. Or does it bleed easily? Is it scaly? Also, you want to look at the nails and look, is it in the regions of the lymph nodes? There are several ways to be able to test what the skin condition is. I included a video for each one of these if you want to see how it's done. I'm not going to play them right now, but just in general, be familiar with the types of testing that might be done. So swabs are just taking, a Q-tip and swabbing the surface of the lesion. Skin scrapings are exactly what they sound like, taking a knife or taking the end of a glass microscope slide and scaling off, scraping off some of the surface of the lesion. Using the wood light, that's an ultraviolet light that's often used to look for skin cancer. So it's, used in a darkened room, and it's the blue light that you can see whether skin lesions are available. Skin biopsy, that's taking a piece of the tissue. And then also the patch and skin prick test for allergies. So testing a person for allergies by injecting a serum that contains the allergen and looking for a reaction. Um, Other descriptors for specific lesions: a cyst is a closed capsule, sac-like structure, usually filled with liquid, semi-solid. They usually occur in almost any type of body tissue, and they can vary in size. Um, Fissures or narrow opening crack are with varying length and depth, usually some breaking or parting of the skin. A macule, I've kind of already talked about. That's that little spots or blemishes on the skin. They're flat. You can't see them from the side. A nodule is a growth of abnormal tissue that develop just below the skin. They can also develop in deeper tissue. Papule, I already described that. It's that distinct border, about 1 centimeter. A polyp is an abnormal growth projecting from a mucous membrane. If it's attached, it's called pedunculated. So if it's attached to the surface, if not, it's called sessile. You don't need to worry about those terms. Polyps are usually found in the colon, the stomach, the nose, the ears, the sinuses, the bladder, or the uterus. A pustule is a bulging patch of skin full of yellowish fluid called pus, hence the name. Think of it as a big pimple. Vesicle, small fluid-filled sacs that appear on your skin. The fluid inside can be clear, white, yellow, or mixed with blood. Sometimes referred to as blisters, so think of that as a blister. And wheal is a patch of skin that's elevated, discolored, changes in shape, often itches. We've referred to wheals as welts or hives, so think of that as like an allergic reaction. Now, just briefly to talk about cancer, squamous cell carcinoma is a form of skin cancer, develops in the squamous cells here that make up the middle and outer layer of the skin. It's not life-threatening, although it can be aggressive in some cases, and untreated can grow into larger areas or spread to other parts of the body that can cause serious complications. So generally, these cancers are often the result of prolonged exposure to ultraviolet lights or radiation from sunlight or from tanning beds. So if you're going tanning or spending a lot of time in the sun, please use sunscreen. Basal cell carcinoma is the most common type of skin cancer. It usually presents as a sore that seems to get better and then recurs and may start to bleed. It often is on the face and neck where the sun is exposed to sunlight. The tumors are invasive and tend to burrow, but they don't metastasize or spread to other locations. They appear as painless, raised red areas on the skin that can be shiny. It grows slowly, but it can damage the tissue around it. But as I said, doesn't really spread anywhere else. So again, it's exposure to sunlight, ultraviolet light. Usually treated surgically. Melanoma is the type of skin cancer that develops from pigment-containing cells and usually occur in the skin, sometimes can occur in the mouth, intestines, or eyes. They usually develop from a mole with concerning changes around the size, the color, the itchiness, the border of the mole. This is usually diagnosed by biopsy, and treatment is usually surgery. This is the most dangerous type of skin cancer. And just to point out the ABCDE scale for looking at moles, you want to look for, is it asymmetrical? Does it have a distinct border? What is the color? What is the diameter? And is it evolving or does it change? So typically in a melanoma, there's asymmetry. The borders are uneven. There are multiple colors within it. It's large and it evolves.